Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question about lower eyelids. When can I have an alternative to lower eyelid surgery or lower blepharoplasty? In other words, when can I use a non-surgical treatment to benefit my lower eyelid appearance? And in answering this question, we'll talk about, when is a non-surgical technique indicated in the lower eyelid? What are the alternative options for treatment? When are surgical options or techniques most indicated for the lower eyelid? And how can I choose the best technique and the best surgeon for me? My name is Dr. Julian De Silva, and I'm a London-based facial cosmetic and plastic surgeon, and eyelid surgery is the commonest treatment I complete for my patients on a daily basis. And the information that we're discussing today is information that I discuss with my patients regularly. So in terms of the indications for lower eyelid techniques that favor non-surgical treatments, first of all, we need to look at the common changes that you see in the lower eyelid that are associated with either aging or genetics. And all changes in the lower eyelid are really a combination of these features. So in terms of common changes, the three common changes that we see are bags in the lower eyelid, and these correspond to a cushion of fat called orbital fat that is coming forwards in the lower eyelid, creating that bulge. Secondly, we can see a tear trough depression beneath the eyelid, and this commonly is seen as a shadow, a dark circle, or sometimes seen as a semicircular depression beneath the lower eyelid. And this corresponds to some loss of volume and the attachment of a ligament beneath the lower eyelid. Thirdly is loose skin. And so all changes in the lower eyelid tend to favor a combination of these three elements. Some swelling of fat coming forwards in the lower eyelid, some degree of a tear trough or depression, and thirdly, some laxity in the skin. And if these changes are relatively mild, then a non-surgical treatment can be effectively used to rejuvenate the lower eyelid. And commonly, this uses a filler, and that filler is used to fill the depression, the tear trough area in the lower eyelid, to lift that depression and smoothen out the contour between the eyelid and your cheek. And so most non-surgical treatments with the lower eyelid are using a volume effect to fill that depression. There are different types of fillers available, and the choice of different fillers is relatively important because in treating the lower eyelid, we want to give a natural result without lumpy, bumpy changes, without swelling. And what is important when considering this is the type of filler, the way in which the filler is inserted into the lower eyelid, and the technique used. And these are all very important in having a good result and avoiding unnecessary risks. So if we look at fillers, what are the different types of fillers? The only fillers that really currently advised to have in the lower eyelid are hyaluronic acid fillers. And hyaluronic acid is a substance that exists naturally in your body. It exists in the skin, it exists in joint, and a clever pharmaceutical company has devised a way of manufacturing this gel, meaning that we can use it to fill areas in the body and smoothen out depressions. The advantage of a hyaluronic acid gel is it's very well accepted. Things like allergies are extremely rare, so it's very well accepted by us as people. But in addition to that, it has an antidote. So there is an antidote that can be used to literally dissolve that hyaluronic acid gel in a matter of hours. And so that makes this filler relatively unique, because other types of fillers that are made of other substances, generally they're not dissolvable with an antidote. So in terms of the lower eyelid, this is a delicate area of the body where millimeters make a difference. Hyaluronic acid fillers are a safe product to be used, which can be dissolved if necessary. The other consideration is the technique in which is used to administer the hyaluronic acid gel. And the older way of doing this was with a needle, and this, by definition, a needle has a sharp point to it, and that sharp point can give you more bruising, more swelling, and very rarely, if a little bit of that filler is injected into a blood vessel around the eye, potentially it could have quite serious consequences. And this is a subject that I've taught both nationally and internationally in advising other clinicians, fellow colleagues, how to avoid issues such as complications around the eyes using techniques that avoid this. And one of the ways is using a cannula as opposed to a needle around the eyelids. And what a cannula is, well, it is a instrument that has a blunt end to it, and so it cannot damage blood vessels in the same way that a needle can. And instead of being traumatic, it will slide naturally in the soft tissues, and by doing that it avoids some of the most serious risks associated with fillers, such as a blockage in a blood vessel and potentially damage to the vision. So a cannula technique is very important when considering using fillers around the eye. When is surgery best suited for the lower eyelid? Well, this really goes back to the three changes that we were talking about that are commonly seen in the lower eyelid. Firstly, fat coming forwards as a bulge in the lower eyelid, that orbital fat. Once it's reached a certain point, only surgery is going to really treat that effectively. Secondly, if there's more of a marked depression from the tear trough, well, alternatives to using filler, which needs to be replaced at least every year, would be fat transfer. And fat transfer, combined with the use of your growth factors such as platelet-rich plasma, can have a much longer lasting effect and doesn't need the same kind of top-ups that fillers need. So a deeper tear trough depression may be treated more effectively with a surgical technique such as fat transfer. And finally, skin laxity. And if there's excess loose skin in the lower eyelid, well, only lower blepharoplasty is truly going to treat that effectively. So in terms of the indications for a more surgical lower eyelid, surgical blepharoplasty would be increased prolapse of fat and swelling in the lower eyelid, a deeper depression or dark circle in the lower eyelid, and increased loose skin in the lower eyelid. And all these indications will give you a more favorable result with lower blepharoplasty. And there are different techniques within lower blepharoplasty that need to be looked at for each individual patient, and that's a little bit outside the scope of this particular video. So in terms of the lower eyelid, well, we've talked about when are non-surgical treatments particularly effective in the lower eyelid. We've talked about the options and the way filler can be used, the different types of filler, and the techniques that can be used in the lower eyelid. And finally, we've talked about more indications for a surgical lower blepharoplasty. In terms of making the best decision for you, whether to have a non-surgical treatment or a surgical lower blepharoplasty, well, it does mean that you need to do a certain amount of research to make sure you're making the best decision for you. And you really need to see a clinician, a surgeon who is able to advise you on the different techniques, assess your personal circumstances, evaluate your eyelids, and give you a specific advice that is based on the changes that you have. And for some patients that may be a more non-surgical treatment. For other patients they may be more likely to benefit from a surgical lower blepharoplasty, and it does mean doing a sufficient amount of research and finding out about your potential surgeon, what are the techniques that they use, what are their before and after photographs are like, and ultimately attending a consultation to discuss your specific indications for surgery, your concerns, and what is the best treatment for you. I hope this information has been useful for you. Thank you for watching.